Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Healthcare. We're talking about lymphedema, a condition that affects the lymphatic system. There is no cure, but treatments are available.
Lymphedema is swelling in the tissues that results from a blockage in the lymphatic system. There are three systems in your tissues that help with oxygenation. So the arteries bring the blood to the tissues, the veins bring the blood away from the tissues, and the lymph vessels help drain all that extra fluid that can happen after surgery or with hot weather or just because sometimes we don't know the reason. Patients who get their lymph nodes taken out are especially susceptible to problems with lymphedema.
What are the symptoms of lymphedema?
The symptoms of lymphedema are swelling, and they can happen in the arm or the leg or even in the chest wall. I think it's particularly frustrating for patients that get lymphedema of the breast because it's not as easy to notice and it doesn't always get picked up as quickly. It's also difficult to discuss for patients because it's an area where we don't really think about somebody having an exam or being touched. So sometimes those patients don't get the treatment they need that we have available to them.
Can you tell me what causes lymphedema?
We don't always know what causes lymphedema. Patients who get their lymph nodes removed from surgery, especially cancer surgery, are more susceptible to lymphedema, but it can happen in any patient. Sometimes it happens and we don't have a reason, and that's when we call it idiopathic, which can be particularly frustrating, but it's still the same treatment.
What are the treatments?
The treatment is manual decompressive therapy and physical therapy or occupational therapy. Here at UMass, we have an excellent occupational therapist, Nancy Tabor at Hanneman, who helps with this problem and will do manual lymphatic drainage on patients as well as show patients how to do a home program. We also order compression garments, whether the lymphedema is in the arm or the leg, or sometimes we would order a glove for the hand. It really depends on where the problem is, what type of compression garment we would order.
Are there short-term treatments and long-term treatments?
Absolutely. So lymphedema can be very frustrating because it can come back, and it's one of those issues where often you need chronic long-term maintenance. So patients will get the manual lymphatic drainage in physical therapy or occupational therapy. Then they will have the compression garment, and if they're going on a plane trip or going to be sitting for a long time, often even if they are better, that's a time we encourage them to wear the compression garment so they don't have the lymphedema come back.
How does lymphedema affect breast cancer patients?
The most important thing about lymphedema is making sure there is not an underlying issue. And we certainly want the patient's cancer to be treated before we address their lymphedema. Once those issues have been addressed and they've been seen by their oncologist or primary care provider, then we do address the lymphedema. And if the cancer is all out of the breast, we can even work on breast tissue for lymphedema. It's a little bit harder to treat than, say, lymphedema in an arm or a leg, but it can be treated in the same way with the manual decongestive therapy.
Do the seasons and temperatures have an effect on symptoms?
Absolutely. So lymphedema is more common in the summer with the hot weather, so we do see more cases of it. And a lot of times we'll have patients come in the spring just to assess them and make sure we're doing everything we can to prevent it during the warm summer months here in Massachusetts.
Does a patient need a referral for lymphedema treatment?
The patient does need a referral for lymphedema treatment. It typically involves twice weekly treatments performed by a trained therapist, whether it's a physical therapist or an occupational therapist. We want someone specially trained in this problem. And in order to get those visits covered by insurance, they would need a referral from their healthcare provider.